My name's Josh Potter. I'm Deputy Director of Commissioning at Tower Hamlets CCG. I oversee all of the CCG's commissioning, but I get most involved in integrated care, and for us the integrated personal commissioning programme is a really big part of the integrated care programme. It's about taking it from getting organisations to work together on a population level to making sure they're focusing down on what matters to people and personalising care as much as possible between health and social care. The particular focus of IPC in Tower Hamlets is on 4 main cohorts. So we're looking at children with special educational needs, we're looking at people with a number of long-term conditions, we're looking at people with learning disabilities, and we're looking at people with significant mental health problems. So the focus has been working through those cohorts to understand what it is that they find not so good about the services they receive at the moment. Are things disjointed, particularly between health and social care? And then working through different methodologies of care planning, which we've developed with our partners, both in Tower Hamlets, including the voluntary sector, but also across East London, to start to develop more personalised care packages for those individuals. So I think the 2 main successes in the first year have been, I think, first of all, we've engaged really well with the different cohorts. We've had an unusual amount of interest in this programme if I compare it to other programmes we run as a CCG. We've had very, very good attendance. People have been very not shy in coming forward to tell us about how services are working at the moment and what can be improved. And it's given us a really good sense of where we're going to need to start, both in terms of framing the personalisation discussions, but also what areas of the market locally we might have to develop, what sort of services aren't there that could be there more. So that's one. I think the other part is on the other sort of more technical end around our linked data set. So we've been working with colleagues across East London for some time under our integrated care work to link data, and we can now link data across all of health, social care, and general practice, and we're starting to look into how that's going to work for the voluntary sector. We've got an excellent programme manager, Zakia, who has been leading all this, so she works for me and my team, but she's pulled together a really strong group of people, so we have very good engagement for our local authority. We have 2 local voluntary sector organisations who dedicate a lot of their time to this programme, and that's created across the statutory sector but also then into the voluntary sector. We have a movement of change, if you like, building that's really helped bring people round, and you can definitely it's one of those programs you hear about it from third parties you weren't expecting to hear from it about. So you'll be talking to them about something else and they'll go, oh right, that relates to integrated personal commissioning, doesn't it? And you're like, yes, it does. Fantastic, great. We're cutting through. So part of it is the leadership. I think part of it as well is just a genuinely good idea, and it has been what a lot of people have been saying should happen for quite a long time, but because of the way the system works, you tend to get encouraged towards the big structural systematic work. When you're engaging with people about this sort of thing, people by definition engage with it on a personal level, and that means that they are more honest and more likely to get involved. The other thing I would expect to see within those cohorts is an improvement in health and well-being. I'd like to see that demonstrated very firmly and quantifiably, so that in 2 years' time we can really scale this up and make it a key part of how people experience services in Tower Hamlets. The idea and the direction we're trying to go in is absolutely the right one, and I've certainly not had any of the normal pushback on is this even the right thing to do, because it plainly is. The difficulties are going to be in changing the system to make it happen. The idea is a great idea. All of the areas are approaching it slightly differently, which is creating a lot of really rich learning. And what also seems to be really good is the national team seem to be picking up that what areas need are frameworks within which to work and a bit of air cover to say you can innovate, you can do things differently. And everything that we've heard in the last couple of days has reinforced that. So I think going forward, I feel going away from this with the team that we've brought with us, that we can go back to Tower Hamlets but only down the road really, go back to Tower Hamlets and continue to innovate and continue to push those boundaries, because essentially we've been given permission.